What's up guys, it's Phil here, Doctor of Physical Therapy. Today we're going to talk about the hot topic of manual therapy. We're going to bring in two different perspectives on manual therapy from prominent figures in the physical therapy world. And let's dive right into it. And before we get started, I first want to address how the field as a whole in physical therapy has been shifting towards more of an active approach. I think this is great because we are now transitioning from a more passive-based approach, such as using ultrasound, electrical stim, massage, to more of an active approach where we're teaching patients to form healthy habits, getting them to exercise and feeling better. In other words, physical therapy is becoming more physical. So I recently stumbled across a pretty good podcast on Physio Explained featuring Dr. Chad Cook. He's a prominent figure in the PT community and also a researcher at Duke University. You can find his socials in the description below. So recently, Dr. Chad Cook published a paper called The 9 Myths of Manual Therapy. Unfortunately, at this time of the video, the paper is only in German and has not been translated into English. Fortunately, on the podcast, we can hear from the author himself, so we can just use that. So before we dive deeper into what Dr. Chad Cook had to say about manual therapy, I just want to preface that we all have our own biases, and it's normal to see differing opinions regarding things in science. AKA, it's normal and healthy to have a healthy discussion and to have differing opinions and interpretations. And ultimately, this is how we can all learn and become better as a profession. So here is where things get interesting. Adam Meakin's also a prominent figure in the PT online space who's known for his strong views against manual therapy. He also listened to this podcast episode by Dr. Chad Cook and wrote a response to some of his claims on his blog. And I'll put the link to his response in the description below. So now to set the stage, you have two smart guys, one pro manual therapy, one against manual therapy, and we're gonna dive into what they say. So how this is gonna work is first I'm gonna talk about what Chad had to say, and then I'm gonna talk about what Adam had to say in response. So I'm gonna lay it all out there, and at the end, I'm gonna discuss my own views about this topic of manual therapy. So I'm not here to pit these two gentlemen against each other. They're both well-respected clinicians in the PT community, and the answer is just not always so black or white. So the first myth that Chad brought up on the podcast is that if manual therapy improves patient experience. He argues that manual therapy is one of the things that improves patient experience. He cites a paper that talks about the value of touch. He also says, when you break down value-based care, it's about cost, quality, but it's also about the patient experience. There are patient expectations that are baked into the patient experience. On the podcast, he also talks about patient tends to seek out solid hands-on care or care they think they need. And Adam responds, I strongly disagree when he says that patients experience more value with hands-on and less value with hands-off approaches. And he says the experience and the value a patient feels when they get from any healthcare appointment is not just about what treatments they get, more about how they were treated. So Adam is arguing that it's not just about touch, but it's also about the whole package, the whole experience of listening, validating, empathizing, explaining, reassuring, educating, planning with the patient. And he says that if you don't do any of the above well, it really doesn't matter if you touch them or not. And Adam also clarifies that he's never said not to touch a patient. He says that you can use touch to reassure and to make the patient feel like they are fully examined, but he's just not super into the specific manual therapy techniques. So number two, another myth that Chad tried to debunk on the podcast, the use of manual therapy leads to patient reliance and decreased self-efficacy. Chad argues that people are experiencing the reiteration effect, which is when you hear something enough and repeat it enough, it just becomes the truth, and you just seem to accept it. And he says that there is no research to back the claim that manual therapy leads to increased patient reliance. On the podcast, Chad claims that self-efficacy is quite rooted in a patient and extremely difficult to change. Self-efficacy is something that a patient comes to you with, not something you create with a patient. And he also says that it's quite naive to think that manual therapy approach of putting your hands on a patient is all of a sudden going to lead this lamb to the slaughter, where they are going to be addicted to this approach. I thought that was pretty funny. But even as a pro manual therapy therapist, he does say that we need to move away from structural narratives surrounding manual therapy. A couple quotes that I liked by him on the podcast were, manual therapy is a pain modulator and a relationship builder. And here's another one. It doesn't change structure, it's not going to relocate spine, and it is not going to do any of the things that had been advocated in the past by different philosophies. So even as a pro manual therapy therapist is moving away from the structural descriptions surrounding manual therapy. Also, I think that overall that is a big step in the right direction. So now let's take a look at what Adam says in response. Adam argues that self-efficacy is an individual's judgment of their capacity to do a specific task in a specific situation. Therefore, it's highly context dependent. And he gives a couple examples. He says, currently I have a high deadlift self-efficacy, meaning I feel very capable to pick up heavy things off the floor. However, this doesn't mean that I'll have the same high levels of deadlift self-efficacy if I have lower back pain. And he also talks about how he has low car maintenance self-efficacy because he doesn't know how to fix a car. When he calls for roadside assistance, his level of efficacy increases because now he's getting help. So now let's take a look at what Adam had to say in response to increased patient reliance for manual therapy. Adam argues that Chad is making the logical fallacy of mistaking an absence of evidence as evidence of absence. So basically, he's saying that just because there's no evidence doesn't mean that there's no relationship between the two. He said Chad cannot say that just because there's no evidence of manual therapy creating dependence in patients, that it doesn't occur or that it cannot do this. And he brings up his clinical experience, talking about how he's seen hundreds and thousands of patients demonstrating dependency on all forms of massage, manipulation, needles, injections, taping, and electrotherapy. And he brings up that he has seen far too many clever, intelligent people tell me that they go to see their guy 5 to 6 times a year to get the pelvises put back in or to get that muscle not rubbed out for 5, 10, or even 20 years because they like, trust, or believe to know it happens. He says that patients often receive unnecessary treatments due to some false, misleading narrative given ignorantly or deliberately by some therapists providing them for payment. I think there's a point where both Chad and Adam agrees upon where the narrative is the problem. It's giving people a misleading narrative that manual therapy is going to fix you or relocate some things or change your structure, which just isn't true. The third myth surrounding manual therapy that Chad debunks is that manual therapy only creates short-term changes and does not lead to long-term outcomes. And he states that within session changes in the spine has small predictions of being able to identify long-term changes, but he says that improvements that last between sessions is better at predicting long-term outcomes. And Adam, in response, wrote, however, I have some questions here. The first is, couldn't both these within and between session changes just be seen in patients with favorable natural histories improving regardless of the treatments they received? I mean, just because a patient gets some manual therapy and then displays some improvement next session doesn't mean that manual therapy was the cause of that. So basically, Adam brings up natural history, which means that some people's symptoms just get better over time without you doing anything. And it's not because of the manual therapy that you did which improved it. And remember, listening and reading to these intellectual discussions is only going to help us grow. Personally, reading Adam's blog and his take on manual therapy has illuminated a lot of things regarding manual therapy in my own practice. For example, he states that, I believe that most manual therapy used in musculoskeletal therapy is overcomplicated, overhyped, and overused. I have to say that I've seen patients become super dependent on a form of treatment, whether that be manual therapy or going to the chiropractor or getting acupuncture. Does that happen to everybody? Of course not. And just like Chad said, if you touch a patient, it's not automatically you're gonna lead the lamb to the slaughter where they're gonna be dependent on you for the rest of their lives. I think the answer is probably somewhere in between. I think what we can agree on is to the shift away from the structural narrative surrounding manual therapy. Instead of saying I'm gonna relocate, realign, fix something with my hands, it's more about creating a general desensitization effect in the area. Manual therapy has a calming effect to the nervous system. Even Chad, the pro manual therapy therapist, says that we should step away from the structural narrative surrounding it. So do I think manual therapy belongs in physical therapy? Absolutely. Do I think that manual therapy is overhyped like the way Adam claims it to be? Probably a little bit. Do I use manual therapy? Yes. Do I provide the most up-to-date narrative surrounding manual therapy? I try my best to. Another thing that I like that Chad brought up was patient expectations. Different patients come in with different expectations. And sometimes we have to be adaptable and figure out what are their expectations for PT. And we have to use our own clinical judgment to figure out what the best plan of care is for this particular patient. And maybe part of that is screening out if the patient in front of you is at risk of becoming more dependent. Depends, so it really all depends. So let me know what you think. And as always, thanks for watching. You know where to find me, and there's more to come.